Clinical research suggests the reason you keep waking up at night to pee is not simply because you drink water or because you're getting older. For millions of men, the real cause is a silent, slow pressure problem happening inside the bladder and prostate system that builds up for years, until your sleep starts getting destroyed, one bathroom trip at a time. And what's scary is that most men don't even realize what's happening. They assume it's normal aging. They assume it's stress. They assume it's just something they must accept. But medical experts say nighttime urination, also called nocturia, is not just an inconvenience. It is often an early warning sign that your urinary system is under strain, and in many cases, it's linked directly to prostate enlargement, chronic inflammation, poor pelvic circulation, hormone imbalance, and bladder overactivity. And the worst part is this: if you keep ignoring it, it doesn't just stay the same, it usually gets worse. Now here's what most men don't understand. When you wake up one time at night to pee, that might not seem like a big deal, but clinical studies suggest that even waking up twice per night is associated with higher fatigue, higher blood pressure, lower testosterone, and increased risk of metabolic problems. And when you wake up 3 or 4 times per night, you are no longer getting deep restorative sleep. Your body cannot fully repair, your brain cannot fully reset, your hormones cannot properly regulate, and over time, your energy drops, your mood becomes unstable, your sexual function weakens, and your confidence slowly collapses. Men start feeling older than they really are, not because of age, but because their body is stuck in a chronic stress loop caused by interrupted sleep. And here is the truth that urologists often mention. Nighttime peeing is one of the most common symptoms of an enlarged prostate, also known as benign prostatic hyperplasia, or BPH. But the real issue isn't just the size of the prostate. The real issue is what that enlargement does to the bladder and the urinary tract. Because as the prostate swells, it begins squeezing the urethra like a hand tightening around a garden hose. That means your bladder has to push harder and harder just to empty. Over time, the bladder muscle becomes thicker and more irritable. It starts overreacting. It starts sending urgency signals even when the bladder is not full. And then something dangerous happens. Your brain gets trained into waking you up, even for small amounts of urine, because your bladder has become hypersensitive. This is why some men pee at night, even if they barely drink anything in the evening. It's not always about water intake. It's about bladder signaling and prostate obstruction. And once this cycle starts, it can feel like your body is broken. But medical experts say it can be reversed in many cases, naturally, if you fix the underlying inflammation, improve urine flow, reduce bladder irritation, and support the hormone environment that influences prostate tissue. And in this video, we're going to go deep into the most powerful science-backed natural strategies that can reduce nighttime peeing, improve prostate health, and restore uninterrupted sleep without surgery. No shame, no embarrassing language, no fake miracle cures, just real research-based approaches that many doctors quietly recommend, but most men never hear about. Because the goal is not to just stop peeing at night. The goal is to stop the entire chain reaction that is causing your prostate and bladder to behave like they're under attack. Now, before we go into solutions, let's expose something important. There are 3 main categories of nighttime peeing, and understanding which one you have can completely change how you fix it. The first category is prostate-driven nocturia. This happens when an enlarged prostate blocks urine flow, leaving the bladder partially full. That leftover urine makes you feel like you need to go again soon. And at night, when your body is relaxed, you feel the pressure even more. The second category is bladder overactivity. This happens when the bladder muscle becomes too sensitive, often due to chronic inflammation, caffeine, sugar spikes, stress hormones, or long-term obstruction. Even small amounts of urine trigger urgency signals. The third category is fluid redistribution and hormone imbalance. This happens when your body holds fluid in the legs during the day and releases it at night, or when your antidiuretic hormone, the hormone that normally reduces urine production at night, becomes weaker due to age, sleep apnea, insulin resistance, or poor circadian rhythm. And many men have a combination of all 3, which is why random advice like stop drinking water after 7 p.m. often doesn't work, because it's not targeting the root cause. So now let's get into the real fixes. Clinical research suggests the first and most powerful natural way to reduce nighttime peeing is to reduce prostate inflammation, because inflammation is like gasoline on the prostate enlargement fire. Even a slightly enlarged prostate can cause massive symptoms if it is inflamed. But if you reduce inflammation, urine flow improves, bladder pressure drops, and nighttime urgency decreases. And this is where most men make a mistake. They focus only on prostate size. But urologists say the real symptom driver is not always size, it's tension, swelling, and inflammation. Think about it like this. A small swollen airway can block breathing more than a larger airway that is relaxed. The same applies to the prostate. So how do you reduce inflammation naturally? Medical experts suggest the first step is removing inflammatory triggers that directly irritate the bladder and prostate. The biggest triggers include alcohol, caffeine, ultra-processed foods, sugary drinks, and heavy dairy intake in sensitive individuals. Now, not every man reacts the same way, but clinical observations show that men who reduce caffeine and alcohol often see improvements in nocturia within 7 to 14 days. Why? Because caffeine is a diuretic and a bladder irritant. It increases urine production and stimulates the bladder muscle. Alcohol does the same and also disrupts sleep cycles, which makes you wake up more easily. That means even small bladder pressure wakes you up. And this is why some men pee 2 or 3 times at night after drinking tea, coffee, or soda during the day, even if they drank it early. The bladder remains irritated for hours. The nervous system remains Now, the second inflammation trigger is sugar. And this is one of the most underestimated causes of nighttime urination. Because when blood sugar is high, your kidneys work harder to flush glucose out. That increases urine volume. But even worse, insulin spikes increase inflammation and hormone disruption. High insulin is linked with prostate tissue growth and increased urinary symptoms. So if you're eating bread, sweets, sugary snacks, or heavy carb meals at night, you might be triggering nocturia without realizing it. Many men think their prostate is the only problem, but the truth is, metabolic inflammation is feeding it. Now, the next powerful natural strategy is improving urine flow by supporting the muscles that control urination. Clinical research suggests the bladder and prostate system depends heavily on smooth muscle relaxation. The prostate contains smooth muscle fibers that tighten when stress hormones rise. This is why stress and anxiety often worsen urinary symptoms. When cortisol and adrenaline rise, the pelvic muscles tighten, the prostate tightens, and urine flow becomes weaker. Then the bladder struggles, leaving more urine behind, and you wake up again later. So if you are under chronic stress, your prostate symptoms will often worsen, even if your diet is perfect. This is why medical experts often recommend magnesium, because magnesium helps relax smooth muscle and reduces nervous system tension. Studies suggest magnesium deficiency is common in older adults and is associated with muscle cramps, poor sleep, and nervous system overactivity. But it also plays a role in bladder control. Some men report reduced nighttime urgency after improving magnesium intake, especially through magnesium glycinate or magnesium citrate. Of course, you should always check with a doctor if you are on medications or have kidney disease, but the science behind magnesium's calming effect is real. Now, another nutrient with strong clinical interest is zinc. Zinc is essential for prostate health. In fact, the prostate contains one of the highest concentrations of zinc in the male body, but zinc levels often decline with age, poor diet, and chronic inflammation. Zinc supports immune regulation, hormone metabolism, and tissue repair. Low zinc is associated with prostate inflammation and hormonal imbalance. Then there is vitamin D. Medical research increasingly links vitamin D deficiency with increased prostate enlargement risk and inflammation. Vitamin D is not just a vitamin, it behaves like a hormone. It influences immune activity, cellular growth, and inflammation control. And many men, especially those who spend more time indoors, have low vitamin D levels. Improving vitamin D status has been linked in some studies with improved urinary symptoms, especially when combined with lifestyle changes. Now let's talk about the most powerful natural compounds studied for prostate-related nighttime peeing. The first is saw palmetto. Saw palmetto has been studied for decades. Some studies show modest improvements in urinary flow and nocturia, while others show mixed results. But many urologists agree that for some men, especially those with mild to moderate symptoms, it can reduce nighttime urgency. The key is quality and dosage. Low-quality supplements often fail. Medical experts often recommend standardized extracts. The second is beta-cetosterol, a plant sterol found in many prostatal supplements. Clinical research suggests beta-cetosterol may improve urine flow and reduce residual urine volume. That means the bladder empties more fully, which reduces nighttime trips. The third is Pygeum africanum, derived from African plum tree bark. It has been shown in some clinical trials to improve nocturia and urinary flow. It may reduce inflammation and improve bladder elasticity. The fourth is pumpkin seed extract. Pumpkin seeds are rich in zinc, phytosterols, and anti-inflammatory compounds. Some studies suggest pumpkin seed oil may improve urinary function and reduce nocturia, particularly in older men. But here is the important truth. Supplements can help, but they are not the foundation. The foundation is lifestyle correction. Now let's talk about the real game changer. Clinical research suggests one of the strongest lifestyle predictors of nighttime peeing is sleep apnea. And this shocks many men, because they think snoring is harmless. But medical experts warn that sleep apnea triggers hormonal disruption that increases urine production at night. When you stop breathing during sleep, your body releases atrial natriuretic peptide, a hormone that signals the kidneys to release more fluid. That means you produce more urine. This is why some men with sleep apnea wake up multiple times at night to urinate. Not because their bladder is full naturally, but because their hormones are forcing excess urine production. So if you snore loudly, wake up with dry mouth, feel tired during the day, or your partner notices breathing pauses, this could be a hidden cause of nocturia. Treating sleep apnea often dramatically reduces nighttime peeing. Now another lifestyle factor is leg swelling and fluid pooling. During the day, if you sit for long hours, fluid can accumulate in the legs. When you lie down at night, that fluid returns to circulation and the kidneys processed it, increasing urine output. This is why men who sit all day often pee more at night. A simple fix is elevating legs for 30 minutes in the evening, wearing compression socks if needed, and walking more during the day. Even light movement helps. Now let's get into diet, because this is where men can see huge changes. Medical experts say the prostate is highly sensitive to inflammatory foods. If your diet is full of fried food, processed meat, sugar, white bread, and seed oils, you are feeding prostate inflammation daily. But if you shift toward anti-inflammatory foods, the prostate environment changes. The top foods associated with better prostate function include tomatoes, especially cooked tomatoes, because they contain lycopene. Lycopene is a powerful antioxidant linked with lower prostate inflammation and healthier prostate tissue. Studies suggest men with higher lycopene intake often have lower prostate-related symptoms. Another powerful food is cruciferous vegetables like broccoli, cauliflower, cabbage, and broccoli sprouts. These contain sulforaphane and indole-3-carbinol, compounds linked with hormone metabolism, support, and cellular detoxification. Some research suggests these compounds may help reduce prostate inflammation and support healthier estrogen-testosterone balance. Then there are omega-3 fatty acids found in fatty fish, like salmon and sardines. Omega-3 salts reduce systemic inflammation and may help reduce prostate swelling and bladder irritation. Then we have nuts and seeds, especially pumpkin seeds, flax seeds, and walnuts. These contain healthy fats and plant compounds that support hormone balance. Then we have green tea, which contains catechins. Some research suggests green tea compounds may support prostate health, but it's important to note that caffeine content can irritate the bladder. So decaffeinated green tea may be a better option for men with nocturia. Now here's something that medical experts say matters even more than what you eat. So when you eat, because eating large meals late at night increases insulin, increases inflammation, and increases urine production. It also increases abdominal pressure, which can irritate the bladder. Men who eat heavy dinners at 9 or 10 p.m. often have worse nocturia than men who eat earlier. A simple shift, eating dinner 3 to 4 hours before bed, can reduce nighttime peeing dramatically for some men. Now let's talk about hydration, because men often do the wrong thing. Many men start restricting water because they're tired of peeing. But clinical research suggests dehydration can actually worsen bladder irritation. Concentrated urine irritates the bladder lining, increasing urgency. So instead of cutting water completely, the smarter strategy is front-loading hydration earlier in the day and reducing fluids 2 hours before bed. That way your urine is less irritating and your bladder is calmer. Now let's talk about pelvic floor health. Most men think pelvic floor exercises are only for women. That is false. The pelvic floor controls bladder function in men too. Weak pelvic muscles can increase urgency and poor control, but tight pelvic muscles can also worsen symptoms. This is why balanced pelvic floor training is important. Gentle Kegel exercises can help some men improve bladder control, but men who are chronically tense may need relaxation techniques instead. Clinical experts often recommend diaphragmatic breathing because deep breathing relaxes pelvic tension and reduces sympathetic nervous system activation. When you breathe shallow, your pelvic muscles tighten. When you breathe deep, they release. Now, another overlooked factor is constipation. If you are constipated, your colon presses against the bladder and prostate. That increases urinary urgency. Many men with nocturia also have poor gut motility. Increasing fiber intake, hydration, and magnesium can help reduce constipation and indirectly reduce nighttime peeing. Now let's get into the 4 biggest daily mistakes that destroy sleep and worsen nocturia. The first mistake is drinking caffeine daily and thinking it's harmless. Even 1 cup can irritate the bladder for hours. Many men don't realize caffeine sensitivity increases with age. Your body clears caffeine slower. That means your morning coffee may still affect your bladder at night. The second mistake is eating sugar at night. Desserts, sweet tea, cookies, bread, even large rice meals can trigger insulin spikes that increase urine production. The third mistake is sitting too long. Sitting compresses pelvic circulation. Poor blood flow increases prostate swelling. Walking daily improves pelvic blood flow and reduces inflammation. The fourth mistake is ignoring the early warning signs. Many men wait until they are waking up 4 or 5 times per night before taking action. But medical experts say early intervention is the key. The sooner you reduce inflammation and improve flow, the easier it is to reverse symptoms naturally. Now, here is a science-based routine that many urologists quietly recommend for men who want to reduce nighttime peeing without surgery. Step 1. Reduce caffeine and alcohol for 14 days. Not forever. Just test it. Many men see improvement quickly. Step 2. Stop heavy meals late at night. Eat earlier. Step 3. Add 1 prostate support food daily, such as tomatoes, pumpkin seeds, broccoli, or salmon. Step 4. Add magnesium glycinate before bed, if appropriate for your health situation. Step 5. Walk 20 to 30 minutes daily, not intense exercise, just movement. Step 6. Elevate legs in the evening if you have swelling. Step 7. Focus on sleep quality and screen reduction before bed, because poor sleep makes your bladder more reactive. Now let's talk about the emotional side of this, because men rarely admit how much nighttime peeing affects them. It doesn't just ruin sleep, it ruins masculinity, confidence, it ruins intimacy, it ruins the feeling of control. Men start planning their life around bathrooms. They stop going on road trips. They stop enjoying long movies. They stop sleeping next to their partner without fear of waking them up. They start feeling embarrassed. They start feeling older. They start feeling like their body is failing them. And that is why this topic matters so much. Because when a man cannot sleep, everything falls apart. His hormones drop. His testosterone drops. His mood drops. His patience drops. His energy drops. His energy drops. His drive drops. And slowly, without realizing it, he becomes a weaker version of himself. But clinical research suggests this is not a life sentence. Your prostate is not a ticking time bomb. It is a living tissue that responds to inflammation, hormones, and lifestyle. And when you give your body the right environment, it can heal. Now, let's go deeper into the truth that most men need to hear. Medical experts say the goal is not to fear surgery. Surgery can help some men, but surgery should never be your first option if your symptoms are mild to moderate. Because many men can dramatically reduce nocturia through natural changes, and those natural changes don't just help the prostate. They improve heart health, they improve metabolism, they improve sexual function, they improve energy, they improve mental clarity. That means when you fix nighttime peeing naturally, you're not just fixing one symptom, you're upgrading your entire body. Because if you can sleep deeply again, your body will restore testosterone, your immune system will repair, your brain will detox, your inflammation will drop, and you will feel younger, not because of magic, but because your body finally has the chance to recover. And this is why so many men report that after fixing nocturia, they suddenly feel like their life came back. They wake up with energy, they wake up with motivation, they wake up without brain fog, they wake up without depression, they wake up without feeling like they are trapped in an old body. Now let's talk about what you should watch out for, because this is important. If you have blood in urine, severe pain, fever, sudden inability to urinate, or unexplained weight loss, you must seek medical evaluation immediately. Because not all urinary symptoms are simple BPH. Sometimes infection or other serious conditions can be involved. Always take warning signs seriously. But if your main issue is waking up multiple times per night, weak stream, dribbling, urgency, and incomplete emptying, then clinical research suggests you are likely dealing with BPH, Urolite, and Nocturia, and the strategies in this video can make a powerful difference. Now here is what I want you to remember. It is a symptom, and symptoms can change. Your body is not permanently broken. Your bladder is not permanently damaged. Your prostate is not permanently doomed. It is reacting to years of inflammation, hormonal imbalance, poor circulation, stress overload, and modern diet damage. And the good news is this: the same way you built the problem slowly, you can reverse it slowly. And every single night you improve even a little bit matters. Because the first night you wake up 1 time instead of 3, you will feel it. The first night you sleep for hours straight without interruption, you will feel like you're breathing again. And the first morning you wake up refreshed, without heaviness in your head, without fatigue in your bones, without that depressed feeling that follows poor sleep. That is the moment you realize something powerful. You were never lazy, you were never weak, you were exhausted. Your body was fighting every night, and now it finally has a chance to heal. So if you're watching this right now, and you've been silently suffering, waking up at 1 a.m., then 3 a.m., then 5 a.m., staring at the ceiling, angry, frustrated, feeling older than you are, medical experts say you are not alone. Millions of men are dealing with this, but only a small percentage actually take action early enough to reverse it naturally. And if you start now, you can be one of them. Because the man who sleeps deeply is a different man. He has energy, he has patience, he has confidence, he has control. And when your sleep returns, your life returns. So don't accept broken sleep as normal aging. Don't accept exhaustion as your new lifestyle. Don't accept bathroom trips as your nightly routine. Clinical research suggests there is a real pathway out of this, and you can start today. Even small changes can create massive results. And the best part is, when you fix your prostate naturally, you're not just avoiding surgery. You're building a stronger, healthier body for the next 10, 20, even 30 years. Because your future does not belong to discomfort. Your future belongs to strength. Your future belongs to peace. Your future belongs to sleep. And it starts with one decision: to stop ignoring the warning signs and start fixing the root cause.